World Health Organization says children under the age of 5 should not be required to wear masks. There's been much confusion for parents on their children wearing masks. Joining me now for clarity via Skype is Dr. Mary Stephen, Technical Officer of the World Health Organization Office for Africa. She's out in the Democratic Republic of Congo for us. Dr. Stevens, thank you very much for your time this afternoon. So, as we pointed out, much confusion in terms of the wearing of masks. How did we get to a point where we are now saying that children under the age of 5 should not be wearing masks?
Yeah, thank you and good afternoon. Thanks for having me. Yes, so there has been a lot of consultations on the needs for wearing masks by children. And as a result of that, as we know that the evidence on how much contribution children make and what age group to the COVID-19 transmission is still evolving. So globally, it's been recorded 1 to 7%. In Europe, they recorded about 4%. So this is a situation that is evolving, and there has been a report that it could be attributed to their stay-at-home situation. So now, because of this limited information, then the decision was made based on, for those under the age of 5, do no harm principle by the experts. So basically, their psychosocial needs and their developmental milestone for these children, and their inability to wear masks without much support from adults. So it has been decided that children under the age of 5 should not wear masks, but of course children from 6 to 11 and from 12 and above should wear masks under given some certain conditions.
Sure. I guess the more we know, or the more we learn about how the virus works, then certain decisions will be made to suit what it is that we are finding out. Curious to get your perspective in terms of the continent. The numbers are not as high as naysayers had predicted in the beginning. A lot of people saying that the African continent will be battered by the coronavirus, but we're sitting at just over 1 million, and the recovery rate being quite high as well. We're not even at 50,000 deaths as the continent. What do you perceive is happening there?
Yes, so for this COVID response, Africa has been really fortunate to slow down the progression of the outbreak. And this is associated with the actions that the government took early on, both implementation of the effective public health measures that we know, the issue of surveillance to detect cases, contact tracing, testing, treatment, isolation, and observance of preventive measures by the general population, the hand washing, physical distancing, and the issue of wearing of face masks. In addition to that, government also implemented different kinds of movement restriction measures. The lockdown measures in different countries has given Africa time, and also contributed to limiting the widespread of the cases on the continent. So we are definitely not seeing this exponential increase that was seen in Europe, America, and other parts of the world.
A country like South Africa, for instance, when we talk about the lockdown measures banning the sale of cigarettes as well as alcohol, but now we have resumed the sale of alcohol, which has led to some reckless behavior from certain sectors of the society. Curious to find out what it is that we are seeing in terms of the rest of the continent where the issue of alcohol is concerned, where some are even calling for it to be banned again here in this country.
Yes, so the issue of alcohol, we know the way COVID is spread. It's basically through human-to-human interactions. And when people take alcohol, the tendency that they could have altered judgment is very, very high. So you can actually lose your sense of control, and there you may not comply with some of those preventive measures of making sure people are staying 1 meter away from others, having properly wearing their face masks, ensuring hand washing and cough etiquette. So if it alters the way we behave, definitely it will alter our compliance with the preventive measures. So it can have a negative impact on how the population comply with the preventive measures for COVID-19, definitely.
Dr. Mary Stephen is the Technical Officer at the World Health Organization Regional Office for Africa out in the Democratic Republic of Congo for us. Thank you very much for your time this afternoon.